Could your daily habits be silently endangering your kidneys? Many people assume kidney disease is a distant threat, but what if your body's vital filters are struggling without a single warning? Imagine waking up one day to discover years of subtle neglect have taken their toll. Medical experts confirm that understanding your personal risk is crucial for prevention, not panic. We've identified the 7 key factors most people overlook, making them vulnerable. Don't let ignorance put your future health at stake. If you care about your health after 60, this is a video you'll want to watch till the end. As we reach our golden years, maintaining our health and independence becomes even more precious. It's natural to want to enjoy every moment with family, pursue hobbies, and live life to the fullest. Our kidneys are truly unsung heroes, tirelessly filtering our blood to remove waste and excess fluids, vital for our overall well-being. They often work silently, meaning problems can develop gradually, sometimes without clear symptoms until they're quite advanced. For those aged 60 and above, the topic of kidney health takes on particular importance. As our bodies age, they naturally become more susceptible to certain conditions. Conditions common in this age group, like high blood pressure and diabetes, are major culprits that can silently damage the kidneys over time. Understanding these risks isn't about fear, it's about empowerment, knowing what to look out for and how to be proactive. Untreated kidney disease can significantly diminish your quality of life. Imagine feeling constantly tired, struggling with swelling, or having less energy for the activities you love, spending time with family, pursuing hobbies, or simply enjoying daily walks. In advanced stages, it can lead to demanding treatments like dialysis, which profoundly impact daily routines and independence. That's why understanding Siapa yang paling berisiko, 7-factor risiko utama penyakit is so vital. It's about arming yourself with knowledge to protect your health, maintain your vitality, and ensure those precious years are lived to the fullest. Alright, let's dive into our first point, the silent, insidious impact of diabetes mellitus on your kidneys. Diabetes isn't just about managing blood sugar, it's a systemic disease that, if not properly controlled, can wreak havoc on nearly every organ, especially your kidneys. In fact, diabetes is the leading cause of kidney failure worldwide, accounting for roughly half of all new cases of end-stage renal disease, ESRD. So, how exactly does high blood sugar damage these vital organs? Your kidneys contain millions of tiny blood vessel clusters called glomeruli, which act as filters. Their job is to remove waste products and excess fluid from your blood while retaining important substances like proteins. When you have diabetes, persistently high levels of glucose in your blood can damage these delicate blood vessels over time. This damage causes the glomeruli to thicken and become scarred, impairing their ability to filter effectively. Initially, this might manifest as your kidneys allowing small amounts of protein, specifically albumin, to leak into your urine, a condition known as microalbuminuria. This is often the first sign of kidney damage in people with diabetes. As the damage progresses, more protein leaks out, and the kidneys become less efficient at removing waste products. This leads to a buildup of toxins in your blood, which can eventually result in chronic kidney disease, CKD. The process is gradual, often without noticeable symptoms in the early stages, which is why diabetes-related kidney disease is sometimes called a silent killer. By the time symptoms like swelling, fatigue, or shortness of breath appear, significant kidney damage has usually occurred. The critical takeaway here is that the duration of diabetes and the level of blood sugar control are paramount. The longer you've had diabetes and the less controlled your blood sugar levels are, the higher your risk of developing kidney complications. But it's not just about glucose. High blood pressure, often a coexisting condition with diabetes, further accelerates kidney damage. Managing both blood sugar and blood pressure aggressively, along with maintaining healthy cholesterol levels, is crucial for protecting your kidney function. Regular monitoring, including urine tests for protein and blood tests to check kidney function, allows for early detection and intervention, which can significantly slow down or even prevent the progression to kidney failure. Have you experienced this? Share in the comments. Moving on to our next crucial factor that significantly elevates the risk of kidney disease, Let's discuss the silent but destructive force of high blood pressure, medically known as hypertension. While often asymptomatic in its early stages, uncontrolled high blood pressure is one of the leading causes of kidney failure worldwide, acting as a relentless assailant on these vital organs. The kidneys are intricate filtering systems, packed with millions of tiny blood vessels called glomeruli, which are essential components of the nephrons, the functional units responsible for filtering waste products and excess fluid from your blood. When blood pressure is consistently high, the force of blood pushing against the walls of these delicate arteries becomes excessive. Over time, this sustained pressure begins to damage and weaken the blood vessels throughout the body, including those within the kidneys. Imagine a garden hose with water flowing through it at an extremely high pressure. Eventually, the hose walls will start to stretch, weaken, and potentially burst or become stiff. Similarly, in the kidneys, the high pressure causes the tiny arteries to narrow, stiffen, and eventually scar, a process known as arteriolosclerosis. This damage significantly impairs the kidney's ability to function effectively. The narrowed and hardened blood vessels cannot deliver sufficient blood flow to the nephrons, starving them of oxygen and nutrients. Consequently, the filtering units become less efficient at removing waste and excess fluid from the blood. As the damage progresses, the kidneys start to leak, allowing important proteins, which should remain in the blood, to escape into the urine, a condition called proteinuria, often an early warning sign of kidney damage. This creates a vicious cycle. Damaged kidneys are less able to regulate blood pressure, which in turn further elevates blood pressure, leading to more kidney damage. The kidneys play a critical role in blood pressure regulation through systems like the renin-angiotensin-aldosterone system, RAAS. When their function is compromised, this delicate balance is disrupted, exacerbating hypertension. Ultimately, this sustained assault leads to a progressive decline in kidney function, culminating in chronic kidney disease, CKD. If left unmanaged, CKD can advance to end-stage renal disease, ESRD, requiring dialysis or a kidney transplant to sustain life. Therefore, understanding and actively managing blood pressure through lifestyle modifications and, if necessary, medication is not just about protecting your heart, it's profoundly about safeguarding the long-term health and functionality of your kidneys. Regular blood pressure checks are paramount for early detection and intervention, preventing this silent killer from irreversibly damaging your renal system. Have you experienced this? Share in the comments. Next, we delve into a factor that stands as the leading cause of kidney failure globally: diabetes. This chronic metabolic condition, characterized by persistently high blood sugar levels, exerts a profoundly damaging effect on the kidneys over time, a process medically known as diabetic nephropathy. The kidneys, with their intricate network of tiny blood vessels called glomeruli, are responsible for filtering waste products and excess fluid from the blood. In individuals with uncontrolled diabetes, high glucose levels begin to injure these delicate blood vessels. Initially, the kidneys may even try to compensate by working harder, leading to a state called hyperfiltration. However, this increased workload, coupled with the direct toxic effects of high glucose, gradually causes the glomeruli to thicken, scar, and harden, a process known as glomerulosclerosis. As this damage progresses, the kidneys lose their ability to filter efficiently. One of the earliest and most significant signs of diabetic kidney disease is the leakage of a protein called albumin into the urine, a condition known as albuminuria. Initially, small amounts may appear, microalbuminuria, but as the damage worsens, larger quantities leak out, macroalbuminuria, indicating more significant kidney impairment. This protein leakage signifies that the filtering units are no longer functioning optimally, allowing essential proteins that should remain in the blood to escape. Beyond direct glucose toxicity, diabetes also promotes inflammation and oxidative stress within the kidneys, further accelerating cellular damage and fibrosis. The presence of coexisting high blood pressure, which is common in people with diabetes, significantly exacerbates kidney damage, creating a vicious cycle that speeds up the decline in kidney function. The insidious nature of diabetic kidney disease is that it often progresses silently for years, showing no noticeable symptoms until a substantial amount of kidney function has been lost. This makes regular screening crucial for individuals with diabetes. Monitoring blood sugar levels closely, aiming for target HbA1c levels, is paramount. Equally important is strict blood pressure control, as hypertension significantly accelerates kidney damage in diabetics. Modern medical advancements also offer specific medications, such as ACE inhibitors, ARBs, and SGLT2 inhibitors, which have demonstrated significant kidney protective benefits beyond just blood sugar or blood pressure control. Adopting a kidney-friendly diet, maintaining a healthy weight, and regular physical activity are also vital components of managing diabetes and preserving kidney health. Proactive and comprehensive management can significantly slow, or even prevent, the progression to end-stage renal disease, highlighting the critical link between diabetes control and kidney longevity. Do you or someone you know manage diabetes? What strategies have you found effective in protecting kidney health? Share your insights below. Moving on from the direct impacts of cardiovascular issues, our fourth significant risk factor for kidney disease, and one that is increasingly prevalent globally, is obesity. Obesity isn't just about carrying excess weight. It's a complex metabolic disorder that significantly burdens the kidneys, both directly and indirectly. Indirectly, obesity is a primary driver for developing type 2 diabetes and hypertension, which, as we've discussed, are the two leading causes of kidney failure worldwide. The more excess weight an individual carries, especially around the abdomen, the higher their risk of developing insulin resistance, which can progress to diabetes. Similarly, obesity often leads to increased blood volume and activation of systems that raise blood pressure, putting undue strain on the delicate blood vessels within the kidneys. Directly, beyond contributing to diabetes and hypertension, obesity exerts its own independent detrimental effects on kidney health. One key mechanism is glomerular hyperfiltration. To meet the increased metabolic demands of a larger body mass, the kidneys work harder, filtering more blood than usual. This sustained overwork, akin to constantly running an engine at maximum capacity, increases pressure within the tiny filtering units of the kidneys called glomeruli. Over time, this elevated pressure damages these delicate filters, leading to protein leakage into the urine, a sign of kidney damage, and a progressive decline in kidney function. Furthermore, adipose tissue, fat, is not merely an inert storage depot, it's an active endocrine organ. Obese individuals have higher levels of pro-inflammatory substances, cytokines, released from their fat cells. This state of chronic, low-grade inflammation directly injures kidney cells and promotes fibrosis, or scarring, within the kidney tissue. This scarring reduces the kidney's ability to filter waste and maintain fluid balance. Obesity also often leads to dyslipidemia, abnormal blood lipid levels, and alterations in the renin-angiotensin-aldosterone system, RAS, both of which can independently contribute to kidney damage. Dyslipidemia can cause atherosclerosis in the renal arteries, reducing blood flow to the kidneys, while RAS activation can lead to increased blood pressure and sodium retention, further stressing the kidneys. The cumulative effect of these mechanisms, increased workload, inflammation, and metabolic disturbances, accelerates the decline of kidney function, significantly increasing the risk of developing chronic kidney disease, CKD, and, eventually, end-stage renal disease, ESRD, requiring dialysis or transplantation. Managing weight through a healthy diet and regular physical activity is therefore a crucial step in protecting your kidney health. Given the rising rates of obesity worldwide, how concerned are you about its impact on public health, especially regarding chronic conditions like kidney disease? Share your thoughts in the comments. Moving on, our fifth significant risk factor, and one that is increasingly prevalent globally, is obesity. More than just an aesthetic concern, obesity is a complex metabolic disease that significantly burdens various organ systems, including the kidneys. Its link to kidney disease is profound and multifaceted, often acting as a gateway to other conditions that directly harm renal function. At its core, obesity contributes to kidney damage through several interconnected pathways. Firstly, it frequently leads to metabolic syndrome, a cluster of conditions including insulin resistance, type 2 diabetes, and hypertension, all notorious destroyers of kidney health. The excess fat tissue, particularly visceral fat, is not inert. It's an active endocrine organ that releases hormones and pro-inflammatory cytokines. This chronic low-grade systemic inflammation directly damages the delicate filtering units of the kidneys, known as glomeruli, and the surrounding tubules. Beyond systemic inflammation, obesity imposes a direct hemodynamic stress on the kidneys. To support the increased metabolic demands of a larger body mass, the kidneys work harder, experiencing what is known as glomerular hyperfiltration. This means the tiny blood vessels within the glomeruli are under increased pressure and flow, leading to structural changes and eventual scarring, glomerulosclerosis. Imagine a filter constantly being pushed beyond its capacity. Over time, it will wear out and become less efficient. This sustained overwork and pressure gradually impair the kidney's ability to filter waste products from the blood effectively. Furthermore, obesity often results in dyslipidemia, an unhealthy balance of fats in the blood, which can contribute to the hardening of arteries, atherosclerosis, throughout the body, including those supplying the kidneys. This reduced blood flow further deprives kidney tissue of vital oxygen and nutrients. There's also evidence of direct lipotoxicity, where fat accumulates within kidney cells themselves, impairing their function. The cumulative effect of these mechanisms, chronic inflammation, hemodynamic stress, metabolic derangements, and altered lipid metabolism, accelerates the progression of kidney damage, potentially leading to chronic kidney disease, CKD, and, if unmanaged, end-stage renal disease. Therefore, maintaining a healthy weight is not merely about appearance or energy levels. It is a critical strategy for preserving long-term kidney health. Have you experienced this? Share in the comments. Moving on to our sixth crucial risk factor, let's discuss a habit many people engage in without fully understanding its profound impact on kidney health: smoking. While often associated with lung and heart disease, smoking is a silent but powerful destroyer of kidney function, significantly increasing your risk of developing chronic kidney disease, CKD, and accelerating its progression if you already have it. The chemicals in cigarette smoke, including nicotine, carbon monoxide, and various carcinogens, exert a direct toxic effect on the delicate blood vessels and cells within your kidneys. Nicotine, for instance, causes vasoconstriction, narrowing the tiny arteries that supply blood to the nephrons, the filtering units of your kidneys. This reduced blood flow deprives kidney tissues of vital oxygen and nutrients, leading to cellular damage and impaired filtration. Over time, this chronic deprivation can lead to irreversible scarring and loss of kidney function. Beyond direct toxicity, smoking indirectly exacerbates other major risk factors for kidney disease. It significantly raises blood pressure, a leading cause of CKD, by damaging arterial walls and increasing their stiffness. For individuals with diabetes, smoking makes blood sugar control more challenging and accelerates the development of diabetic nephropathy, the most common cause of kidney failure. The oxidative stress induced by smoking, through the generation of harmful free radicals, further damages kidney cells and promotes inflammation. This chronic inflammation contributes to the breakdown of the kidney's filtering membranes, leading to proteinuria, the presence of excess protein in the urine, which is an early and critical sign of kidney damage. Studies have consistently shown that smokers have a higher risk of developing CKD compared to non-smokers, and the risk increases with the duration and intensity of smoking. Furthermore, in patients already diagnosed with CKD, continuing to smoke dramatically hastens the decline in kidney function, often leading to end-stage renal disease, ESRD, and the need for dialysis or a kidney transplant much sooner. The cumulative damage from years of smoking can silently erode your kidney's capacity, making it less resilient to other stresses and increasing the likelihood of failure. Quitting smoking, however, can halt or slow this progression, demonstrating the powerful benefit of this lifestyle change. It allows the kidneys to begin a process of recovery, improving blood flow and reducing inflammation, thereby preserving their vital function. Have you experienced this? Share in the comments. Moving on to our final but equally crucial risk factor, we must address the often overlooked danger of the chronic use of certain medications. While drugs are designed to heal and manage conditions, Prolonged and unmonitored intake of specific pharmaceutical agents can insidiously damage your kidneys, sometimes irreversibly. The most common culprits in this category are non-steroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen and naproxen. Many people routinely take these over-the-counter pain relievers for chronic pain, headaches, or arthritis, unaware of the silent toll they can take on their renal health. NSAIDs work by inhibiting enzymes called cyclooxygenases, COX, which are involved in pain and inflammation. However, these enzymes also play a vital role in maintaining kidney blood flow and function, especially when the body is under stress or in individuals with pre-existing kidney conditions. By blocking COX enzymes, NSAIDs can constrict the blood vessels leading to the kidneys, reducing blood flow and oxygen supply, a condition known as acute kidney injury. Over time, this repeated stress can lead to chronic kidney disease. Furthermore, some NSAIDs can directly cause inflammation and scarring within the kidney tubules, leading to chronic interstitial nephritis. Beyond NSAIDs, other medications can also pose a significant risk if used long-term or inappropriately. Certain antibiotics, particularly aminoglycosides, can be nephrotoxic, though their use is typically monitored. Proton pump inhibitors, PPIs, commonly used for acid reflux, have been linked to an increased risk of kidney disease with prolonged use. Lithium, used for bipolar disorder, and some antiviral drugs can also accumulate and cause damage. It's not just prescription medications. Some herbal supplements, especially those not regulated or containing undisclosed ingredients, can also contain nephrotoxic compounds. The risk of medication-induced kidney damage is amplified in individuals who are elderly, dehydrated, have pre-existing kidney disease, or are taking multiple medications that can interact negatively. Therefore, it is paramount to always consult with a healthcare professional before starting any long-term medication, including over-the-counter pain relievers. Understanding potential side effects, adhering to prescribed dosages, and being aware of drug interactions are essential steps in protecting your kidney health. Never assume that over-the-counter means harmless when it comes to chronic use. Have you ever been advised about the kidney risks of your regular medications? Share your experiences in the comments. Moving on to our final but equally crucial risk factor, we must address the often overlooked danger of the chronic use of certain medications. While drugs are designed to heal and manage conditions, prolonged and unmonitored intake of specific pharmaceutical agents can insidiously damage your kidneys, sometimes irreversibly. The most common culprits in this category are non-steroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen and naproxen. Many people routinely take these over-the-counter pain relievers for chronic pain, headaches, or arthritis, unaware of the silent toll they can take on their renal health. NSAIDs work by inhibiting enzymes called cyclooxygenases, COX, which are involved in pain and inflammation. However, these enzymes also play a vital role in maintaining kidney blood flow and function, especially when the body is under stress or in individuals with pre-existing kidney conditions. By blocking COX enzymes, NSAIDs can constrict the blood vessels leading to the kidneys, reducing blood flow and oxygen supply, a condition known as acute kidney injury. Over time, this repeated stress can lead to chronic kidney disease. Furthermore, some NSAIDs can directly cause inflammation and scarring within the kidney tubules, leading to chronic interstitial nephritis. Beyond NSAIDs, other medications can also pose a significant risk if used long-term or inappropriately. Certain antibiotics, particularly aminoglycosides, can be nephrotoxic, though their use is typically monitored. Proton pump inhibitors, PPIs, commonly used for acid reflux, have been linked to an increased risk of kidney disease with prolonged use. Lithium, used for bipolar disorder, and some antiviral drugs can also accumulate and cause damage. It's not just prescription medications. Some herbal supplements, especially those not regulated or containing undisclosed ingredients, can also contain nephrotoxic compounds. The risk of medication-induced kidney damage is amplified in individuals who are elderly, dehydrated, have pre-existing kidney disease, or are taking multiple medications that can interact negatively. Therefore, it is paramount to always consult with a healthcare professional before starting any long-term medication, including over-the-counter pain relievers. Understanding potential side effects, adhering to prescribed dosages, and being aware of drug interactions are essential steps in protecting your kidney health. Never assume that over-the-counter means harmless when it comes to chronic use. Have you ever been advised about the kidney risks of your regular medications? Share your experiences in the comments.